Hey, it's Scott. And we're here at the Tennessee EMS conference in beautiful Gatlinburg, Tennessee. And as some of y'all remember from a previous Give Me Five, I'm here this evening with Angie Bowen. And previously, she went ahead and was one of our guest experts in regards to hazmat and deconning of little kids. However, this evening, we want to go ahead with Angie and touch on a very topical topic these days. And that's the whole idea of PECs. Miss Angie.
Well, thank you, Scott. Glad to be with you guys. So, a PEC is a pediatric emergency care coordinator. This concept grew out of the National Pediatric Readiness Project and started in our emergency departments and moved into our pre hospital setting. So, currently, I'm the PEC for Jefferson County EMS here in East Tennessee. But people always have questions about what is a PEC? What do you do? Do you have to have specific pediatric expertise? And the biggest thing that I can tell everybody is you don't have to have the pediatric expertise. You just have to be willing to ask the question, what about the children? Uh, if you have a seat at the table, we can raise your hand and say, we have a new policy and procedure that we would like to put into place. Are we including children in this? We're buying new equipment. How does it work with the kids? So I think that's a huge piece of being a PEC is the willingness to bring up the question, what about the children? And I think the enemy of good is perfect. And you don't have to be perfect. You don't have to have all this pediatric knowledge. You just need to be asking the question and you need to know where to get some resources. And I think that's really important too because a lot of people don't know where to look for resources. So, one of the great starting places, whether you're in the emergency department or working in EMS in the pre hospital setting, is to go to the Pediatric National Readiness Project. There are self surveys you can do, self assessments to see sort of where you stand. The pre hospital assessment that was done in 2024 is actually closed for benchmarking against it. However, you can still do self assessments, and both of these sites have toolkits and resources that you can use, and I think that's a great starting place. They also have some sample job descriptions if you're trying to pull something together for your agency or for your hospital. It's a great place to start.
The Pete's readiness thing that she touched on really is a big deal. And again, it comes out through MSC, and they've had various iterations over the years. And it's essentially just a quick survey. And quick survey is regrettably not the right answer. There's a whole lot of
There's a lot.
information in there. It takes more than a couple minutes to complete this survey, but really it looks and it says, okay, essentially, what training do you have? What equipment do you
Yes.
have? Do you have a baby mask? Do you have a XYZ or a PDQ? And it's just a way of saying this is what really smart people who like to take care of kids recommend that you should have. And
Yes.
then it's a way to say, okay, what do we actually have and what do we not have?
Yes.
And then
Absolutely.
they're looking and they're saying, okay, what percentage of people actually have this? And just as a way to say, what can we do to make this better? So, since the vast majority of children statistically don't go to XYZ Kids Hospital, the vast majority of them live in the community, they get sick, they go to community hospital, and the vast majority of them, whether it's by ambulance or just walking in the door, do just fine. If you happen to be a PEC coordinator champion, whichever term you like to use, what, for lack of a better term, is your role? What is your job? Is this the full time, I'm going to do 40 hours a week and do this type role? What do they expect you to do if you decide that you have been voluntold or you actually volunteer to become a PEC? What do you actually do?
Well, I think you could certainly make it into a full time job. It depends on the size of your agency, the size of your service, but in my case, it's a part time job, and it doesn't have to occupy a full FTE for somebody. It's something that you can fill in the gaps. So some of the things that I do in my role is I QA all of our pediatric calls. My service runs about 1,200 calls a month, and maybe 20-ish or so are pediatric. So it's not a whole lot to have to QA, but we look for patterns. Um, I help with standardized education, all the alphabet courses that our training center offers. Teach those. I do a lot of on shift in service. And by that, I mean you take 10 minutes with a crew and draw up, say, EPI 1 to 1,000. Do some simple things that don't take long and doesn't keep that crew out of service, but is a technique that they should know, but they don't use every single day. So doing some of those things is very helpful. Try to put things on our bulletin boards. I use your Take 5 and your Pediatric Pearls and put those on our bulletin boards, so that's a nice little snippet of pediatric care that people can use. Something important that I think that I do and that I would recommend is I work with other healthcare providers and emergency response agencies in our community to try to build on this, because we're all stronger as one, right? So we work better as coalition of providers. So I liaison with our local hospital, which is a community hospital and does not specialize in kids. I also keep in close touch with our comprehensive regional pediatric center and our regional trauma center, and our stroke centers, because kids do have strokes. Kids have strokes. So that's really important. But I work with our fire departments, our law enforcement agencies, to capitalize on what they're doing. A lot of our fire departments are doing a lot of injury prevention. Law enforcement's doing a lot of injury prevention. So that's a perfect place to partner together. And it helps also build those relationships and those networks to better care for the kids. Another avenue, I think, is through your local healthcare coalitions. We have a very active regional healthcare coalition here, the Knox East Tennessee Healthcare Coalition, and we partner with them to provide a lot of equipment and training and include kids in disaster preparedness. So that's particularly important. I do also sit on our regional child fatality review team, which is not a fun part of the job, but it does help us identify needs, especially as it comes to injury prevention and education in the community. So there's a lot of different paths you can take, and you can take whatever pieces of that time allows. The whole point is not to make it perfect for kids, it's to improve the care of kids in our community.
I like it. And it kind of just really comes down to, for lack of a better term, again, you don't have to be a pediatric expert.
Absolutely not.
At the very end, just send us a note and we'll be more than happy, between Angie, myself, and various other really smart people. We're going to go ahead and compile a list of suggested resources. They're all out there. Essentially, why reinvent the wheel if you don't need to? There's boatloads of stuff out there. It's already been done. So with that, whether you're a champion or a coordinator, you're going to see kids. Whether you wish to or not, you're going to see kids. And having somebody who actually takes that little bit of effort to make the next time you have to take care for a kid a little bit easier, the kids and their families really appreciate it. Is Angie, as always, thanks so much.
Great to have you, Scott.
Cheers.
Thank you.